said, we're going to put the fulcrum on the incisal edge of the lower interiors and then determine the cutting edge. And that is going to tell you where that instrument goes. So this is the cutting edge here. So this is going to be buccal. This is going to be lingual. And now remember, it's 2-point contact. So the crown of the tooth is going to touch the shank. So that and that. So there's 2 points.
You don't want to, it's only going to be to remove like at the beginning the calculus, but not the whole calculus, right?
It's only to rough it up so that you can use a greasy to finish the job.
It's good. It's best for varnished. It's the
It's really varnished,
it's your own.
burnished calculus, okay? So here's lingual and buccal. Put your fulcrum on the incisal edge, and it's gonna tell you exactly where it's used.
Professor Newville, and that's just it's not necessarily, you're not walking it in or anything, it's just where your burnish calculus is, and it's just a upstroke.
Just get the, towards the base of it. You don't wanna get on the cementum.
Okay,
You get just at the edge of the calculus and bring it straight up.
okay.
Okay, and again, 2-point
Mash it
contact.
in. You kind of like mash it in a little bit too, in a way. You know, like you
Crush it.
Yeah, it's like
Crush it.
a crushing. It's like a crushing type of thing.
Okay, so here, incisal edge, where's the cutting edge? Right there. So this is going to be for the distal. This is going to be for the lingual, or mesial. But you can see how this won't be buccal. Because to be buccal, you'd have to be over here. So you have to put your fulcrum on the interior incisal edge. And then your 2-point contact. Here and here. Basically all there is to the file.
Which one's for anteriors?
Oh, it's gonna be the same thing for the anteriors then. So if you hold it right here, here's the cutting edge, right? So this is going to be for the facial. Here's the cutting edge. Here's the lingual. Put it on the incisal edge. Here's the cutting edge. This is going to be for surfaces to the patient's right. Surfaces to the patient's left.
So you see how every time she does it, the handle's going out of the mouth? If you adapt it and the handle's going at 9 o'clock or 3 o'clock, then you know it's wrong.
That's a good way to describe it.
So the handle's always going out of the mouth.
You're always on the incisal edge, and the handle is at a 45-degree angle out. Because if I'm over here, that's not going to work. You have to have it on the interior incisal edge.
So then
Okay.
the one you use buccal, lingual, and posterior is
What?
the one you use buccal, lingual on the posterior is mesial and distal on the anterior.
Okay, let's do that. So, lingual, buccal, surfaces to the right, surfaces to the left. Distal, mesial, facial, lingual. Okay?
Oh, so they're like the opposites.
And then the Nabers probe. So again, anterior incisal edge, you'll go in, and however far you go in, it's going to tell you whether it's through and through, how far you're in, and in the type it on, it can get stuck.
I got mine stuck, yeah.
There you go. But see, here are the 3, 6, 9, just like on a straight probe.
So do we're gonna chart those numbers too? Is it, well, we're gonna go under?
It's,
Oh.
I don't know, I don't think you really can.
No.
Okay.
You still use the regular furcation classifications, but it kind of, when you're determining the classification, you look at the distance of the marginal ridges of the occlusal surface of the crown. And so that just kind of gives you an idea, like if the entire distance, let's just say, is 6 millimeters, and you go in 3 millimeters, and you know, oh, it's halfway through.
Oh, okay.
You know,
It,
Okay.
it
it's kinda like a
determines
guide.
whether
Okay.
it's a
Like a
FERCA
full-
1,
full-
2, or
okay.
3.
Yeah, but you don't
See,
record
so-
a number like with a marquee
Okay.
or something.
If you hold it like this, you can see it's about 6 millimeters across the top.
Okay.
So if when you stick it in, you can see that there's only 3 millimeters in, you know it's not gonna be through and through. So it'll be a tube,
Okay.
okay?
Quick question about the furcations. There's only 3 classifications, right?
Correct.
Okay.
Isn't there 4 in the
Yeah.
case?
That's why-
Now-
Oh, 4 if the tissue's missing too.
Okay.
If you can see it
Okay,
and
yeah.
it's through and through, then it's a 4.
Okay.
So here, this has the extended shank and the very small or micro mini cutting edge. This is the one where you're going to be finger flexing because you're down so far that if you don't finger flex, you're going to close the blade.
Do you
So you-
only finger flex or you do both? And,
Well, you'll do a little bit of both. Okay? So, this is the mesial. Mesial. Here's your 13, 14. The distal, remember the V to the D.
Are you showing them in the furcation too?
Oh, no, I will.
Show them how you use that.
And then here's the anterior. Now, so what she's talking about is you can see, so this is going to be the distal, correct? So you're going to use it here, and then you'll use it on the distal root, or the distal surface of the mesial root. So you'll do it there and there in the furcation. And then this is the mesial. So you'll use it on the mesial surface of the distal root. And then you'll just take it and kind of scoop it out like that.
these are two other ones that we haven't seen or worked with.
This is just a Perio Explorer. That's just getting into like the furcations, and it's kind of an alternate without measurement getting into the Furcation Explorer. And then this one, this is the one you're a pro at.
It has
love
like
this
a
one.
curette.
Oh, this is the younger good.
Yeah, I love the younger good. This is my favorite instrument. This thing's the best.
Dr. Gonzalez was saying the same thing.
Oh yeah,
She
this
loves
thing's the
it.
best. I think you could pass your boards if you have this and a 204 SD. Like if I had to choose 2 things, which luckily you don't have to. But anyway, yeah. So this is really nice because it's if you compare this to your Nevi 4, of course it's got a rounded toe because it's a universal. But it's got a similar design of the shank, so or actually what a better comparison would be to hold that up to your Barnhart. And you'll see that the Barnhart has a shorter functional shank, and it's got a more severe angle on the terminal shank, as opposed to this one's got a longer functional shank and a longer curve. So it's good for getting down like 5, 6 millimeter pockets. It's good for heavier calculus. It's not as flexible as the Barnhart. And I love it. I think that's just,
So you use it
I like it a
like
lot.
as a universal, but for deeper pockets.
like if I was doing a code, and that doesn't mean you have to do it, but what I do, anytime I have codes, I always start with the younger good. And I just go to town with that thing, and then I use my Gracie's as finishing if I need to.
Okay.
Or I might, if I don't have a younger good, then I'll use a Nevi 4. I like that. Or I like the McCalls, it depends. But yeah, I like universals, and so that's one that's very versatile. But you wouldn't want to use that on a code 1 because there's a Barnhart's a better choice because it's got a shorter functional chain.
This one has blades on both sides?
Yeah, it's universal.
Okay. And then how do you sharpen this one since it has like that little...
You sharpen it just like you sharpen any universal. Just make sure the face
The angle.
is parallel to the floor,
Okay,
and then you're good to go.
okay.
Yeah, if you have that face parallel to the floor, any universal is gonna be the same angle.
Okay, perfect.
Or greasy.
Well, I haven't used this one, so I'm gonna use it.
Yeah, I think you'll really like it's especially good from the back position
Okay,
because you can really like if you're at the back position, you can really get to the base of the pocket, and like it can take a lot of lateral pressure.
thank you.
Okay, any other questions? Are there any other instruments we haven't gone over that you got in your issue?
These.
Okay. We will see you, Tuesday morning.
Okay, so just a quick announcement, we're all here, right?